This morning, Rick Slayman is waking up in his own bed after receiving the world's first successful transplant of a genetically modified pig's kidney into a human. The 62-year-old discharged from Massachusetts General Hospital Wednesday, saying his recovery is progressing smoothly just 18 days after the groundbreaking operation.
It was a high wire act in the OR.
At the time, doctors hailing the 4-hour-long surgery as a success and their patient a hero. Slayman was fighting end-stage kidney disease, undergoing dialysis for 7 years before receiving his first transplanted kidney from a human donor, which failed last year. Doctors emotional as they reflected on the monumental achievement.
My deepest gratitude goes to our MGH team.
More than 90,000 people are on the wait list for a kidney in the U.S., but less than 16,000 are transplanted annually. On average, 13 patients die every day while they wait.
The opportunity for future transplantation could save a lot of lives. I think the two things will be monitoring for complications related to immunosuppression to suppress the immune system from rejection. But with that, they've got to watch for the complications, which are really infections and malignancies post-transplant.
Slayman sharing a message of hope. Today marks a new beginning, not just for me, but for them as well.
Renal failure can really take a toll on the immune system, making infections a serious concern, especially for those on dialysis. When kidneys fail, toxins build up, weakening our defenses. That's why doctors monitor us closely with blood tests like CBCs and blood cultures to catch any signs of infection early. For dialysis patients, keeping the access site clean and practicing good hand hygiene is crucial. We need to avoid sick people and follow our antibiotic regimens if prescribed. Dialysis itself can increase infection risks due to the access points for bacteria. If you ever notice fever, chills, or redness at the access site, it's vital to alert your doctor right away. After dialysis, medications like antibiotics and supplements can help manage these risks. Staying informed and proactive is key to maintaining our health and reducing infection risks.
Every day, over 90,000 people wait for a kidney transplant in the U.S., and shockingly, 35% of them are African American. Despite making up only 13% of the population, we face a silent injustice. The wait is agonizing, with strict rules that patients must follow, yet for over 14,000 individuals, a racially biased test delayed their placement on the transplant list. This isn't just a glitch. It's a systemic issue that has led to unnecessary suffering and loss. While the sickest patients, many of them Black, were overlooked, kidneys were allocated to those lower on the list, often white and Asian recipients. Investigations reveal a troubling lack of transparency and accountability in our healthcare system. Lives were lost, trust was broken, and justice remains elusive. We must demand change, advocate for equitable healthcare, and ensure that every patient, regardless of race or income, receives the care they deserve.